It starts with tingling wherever your bleed is, and then comes the pain. Next is thinking how much medication you need to do to treat that bleed. There's a lot of caution when it comes to doing activities and what you can do in everyday life. I did play sports, but I had a very controlling and concerned mom, so. My first memory about hearing about the gene therapy, I had an appointment checkup. The number one thing that was most interesting for me was the ability to change my factor level. I remember Nurse Kim saying that it can change my factor levels from minus 1% to above, depending how well I did with the treatment. And at the time, it wasn't believable, but now I understand that, and I know that it is believable. Before the treatment, I was at less than 1%, and after I was above 6%, so I went from severe to mild. The treatment was only 1 day, but when they gave me the gene therapy, and in about a day, it changed my life. It's just, I don't have to factor up as much now. So from going from 1 day to a week, it's definitely beneficial to having a life and just taking care of your body as well. After the treatment, I spent a lot more time doing physical activities, like, probably shouldn't say this, football. I play football now. Yeah, I know, that's like a big no-no in hemophilia, I know. But even doing that, there's a lot of times where I still don't get a bleed from doing those things. For me, treating, if I do have a bleed, it's maybe once every 3 months. I also do a lot of swimming just to help out my joints as well. My mother, she loves it just because my life has changed. She doesn't have to worry as much about my health when it comes to hemophilia, especially when it comes to the factor and the half-life on the factor. When I wake up in the morning, I don't think about hemophilia. When I go to bed, I don't think about hemophilia. It's a beautiful thing. Amazing. Amazing. Yeah.